would love for you to just introduce yourself and where you're from.
Great. So my name is Dr. Kelsey Asplin. I work in the Denver area. I actually grew up in Lakewood, so I am one of the few Colorado natives still here. I got my doctorate of naturopathic medicine from Bastyr University in Seattle and have been practicing primary care and now specializing in men's health for about the last 5 years in Denver.
That's awesome. How did you get into men's health?
I think what I was finding is, through my own journey, through my own life, and then also the interactions I've had with men in like my entire life, is that as great as it is that we're focusing on women's health and women's empowerment, men are getting left behind in that. And really I think for women to be empowered, men need to be empowered. Like, we all raise each other up, right? It's not just men or just women. It's everybody's sexual health and everybody's gender health all kind of comes together to support each other. And if we're doing all of this work to just support women, then men are kind of left in this place of not understanding their identity, not understanding their place, not understanding how they can support women or accept women who are becoming really empowered. And so men also need just as much help and support in learning how to adapt to this new world that we're in and this new identity for different genders, and what it means to be a man, and what does masculinity actually look like in 2020 versus the 1980s. And I think that men and women can raise each other up, and so I wanted to be a part of that.
That's awesome. So I wanted to do this kind of series because a lot of people are home either by themselves or with their partners, and things are not going as planned in terms of both, I think, physical and emotional intimacy.
Yeah.
So there are obviously so many things that go into that. And I know that you and I have in the past sort of discussed hormonal implications and contributing factors. So I would love to just hear when we're talking about hormones, what are we really talking about? What hormones are we talking about?
Mm-hmm. Great question. So I'm sure you've talked about this many times with your patients too, but when it comes to the endocrine system or the hormone system, it's really a dance, right? So if we're talking about thyroid hormones and your insulin from your pancreas and your sex hormones like estrogen and testosterone, all of them dance together. And so if one of those hormones starts getting out of balance, then it can set off the rest of them. And the main ones that I talk about, especially when we're talking about sexual health, are, obviously your testosterone and estrogen, but then also cortisol, which is our primary stress hormone, and your thyroid hormones. And those interweave with each other quite a bit. And so if your stress hormones go up, that can affect your thyroid hormones and your sex hormones. If your thyroid hormones go down, that can also affect your sex hormones and your energy and just your general desire. And so it's never one thing. I think it's really important to realize we're not looking at hormones or libido in a test tube. It's really all of these pieces that come together and all of the variables that make things happen.
Yeah, that's great. I totally agree. We talk about that a lot. Like, it's not just one thing that puts people in pain. It's not just one thing that's going to get you out of it. It's not just one thing that turns you on. It's not going to be just one thing that turns you off.
Right.
So I think I think a lot of people, when they hear about the thyroid, they think that it only impacts women. Is that true or false?
That is false. I actually have a number of men in my practice who have thyroid issues on some level. It's not always a black and white hyperthyroid, hypothyroid, Hashimoto's, Graves' disease, right? You can have subclinical hypothyroidism, or you can have things where the thyroid and the brain seem to be functioning optimally, but for, maybe the cause is mitochondrial dysfunction, that the thyroid hormone isn't actually able to affect the body cells the way that we want it to. And that can absolutely affect energy, and that can affect our metabolism, and that can affect our libido. So it definitely plays a role in men and women.
So how would I know if my lack of libido is related to a hormonal issue?
Great question. I would say my approach to that would be, one, asking a lot of questions and getting more information about exactly what's going on and trying to put the pieces together. Lab tests can be really helpful. They're not always perfect. And I think also, depending on what doctor is looking at them, we all have a different way of seeing the results. There's plenty of doctors who will look at them, and if you fall within the designated reference range, then you're normal. And unfortunately, what's on paper doesn't always reflect the reality of that person's life. And so it's taking the combination of their story, their reality, with the lab results and putting that into perspective to try to figure out exactly what's going on.
I muted myself.
There you go.
Yeah. So if I am currently lacking libido and I really want to be interested in my partner, I love my partner, I want to be intimate, I want to be intimate with my partner, what are some things that I can do to support that?
So things I would think about first is, trying to assess where the problem might be from, right? So a big thing in my practice is figuring out the root cause, right? What's at the base of that? And I think people have a general reaction of saying, I'm not in the mood, so it must be something wrong with me, right? Or if there's something wrong with me, then it's almost certainly my sex hormones or my libido, or I'm not attracted to this person, or it's a problem in our relationship. And yeah, that can happen sometimes, but that's not really the cause of it the majority of the time. And so I would start assessing what's going on in this body that's maybe making me not want to get ready to go, right? Am I stressed? And that's a hard question because I think people generally live in a certain level of stress all the time. And especially in times like now, we may be in a certain amount of denial about how much stress we are under. And so that can play a huge role. And I'll go into the stress response a little bit more in a minute. But if there's stress in the relationship, that can absolutely plummet your libido. If there's stress even outside of the relationship, it's really easy to bring that home. If there's any kind of inflammation or pain going on in the body, or if there's things coming in the body that could be disrupting your hormones. So it may not be an organic hormone issue, but it could be secondary to something else.
Yeah, that's so helpful. I would love to hear you kind of describe the stress response a little bit more.
Yeah, so the way that I like to think about the stress response, the way it's designed in the body was really as a survival mechanism. So if you go back into our early humanoid days, right, and just imagine that we're living out in the jungle with the dinosaurs. Obviously, that's not correct, but let's just roll with that. Okay. Our stress response is designed to help us survive so that if something sneaks up on us in the middle of the night, we wake up, we see it, we're alerted, and we can either fight it or run away, right? Or play dead. And that response in the body hasn't really changed, even though our lives have. And so, the typical response is your pupils dilate so you can see the dinosaur coming up from far away, right? It changes your heart rate, it changes your respiratory rate so that you're getting more air into your lungs and that your blood flow is going out to the extremities. We preferentially move blood to your muscles and to your heart so you can run away, and we move it away from your intestines so you're not digesting, right? So if we think about it in terms of survival, whether you're stuck in traffic on I-25 or you're fighting with your partner or you're stressed out at work, your body essentially sees that as just a bunch of different dinosaur interactions that are happening throughout the day.
Or you're living in a global pandemic where you have no idea what to expect on a given day or when this is going to end or where your money's going to come from.
Exactly. And so we're all living in this runaway from the dinosaur state. And if you are running from a dinosaur, your body does not think you need to be making babies. Okay, so your hormones are going to drop. They're going to plummet because that's not where you need to be spending your time right now if you're just trying to survive.
Yeah, that's exactly how I talk about it with all my people. I don't know why we all have this narrative about running from velociraptors. I think it's got to be Jurassic Park, but 100%. It's like velociraptors and saber-toothed tigers, right? Like that's what we're running from.
Yes, that must have been put into our brains when we were really little.
Yeah, that's it. I like see in my head little people like running from dinosaurs. So funny. I think that is an incredible explanation and so relevant. I love that. What I heard you say is that, yes, there can absolutely be hormonal issues. There can absolutely be physiological issues. I see that there can, those same things. I can see that there can absolutely be issues in the tissues. And until you get those checked out, you don't know for sure. Mm-hmm. And a lot of the time, there are lots of things contributing to it that are none of those things.
Exactly.
Yeah. Exactly. Awesome. So what are some things that people can do now in this time where like maybe they don't have access to laboratory testing, maybe they can't come in and see anybody right now? What are some recommendations of things that people can try?
So I think it really comes back to enhancing those foundational aspects that are important to anything health related, right? So it's really back to the basics. So if we want to start talking about sleep, I think that's a great place. So sleep is so important to our health. When we sleep, that's actually when we produce greater amounts of growth hormone. It's when our cortisol levels or our stress hormone come down. It's when our thyroid or TSH hormone comes down. So everything can start to restore and repair itself. And that actually paves the way for our sex hormones to be able to, come up better during the day. So sleep is really important. If people aren't getting enough sleep, which most people aren't getting enough sleep, that is essentially a stress on the body. That's another dinosaur that you're running from. And so you keep your cortisol levels high when they shouldn't be high at night. And that's going to be suppressing your thyroid function and suppressing your testosterone and estrogen production as well. So sleep hygiene is really important. I know, like right now, I'm sure I'm not alone in this, but I've been spending way more time on, social media and on the news late at night. And that's absolutely causing me to have a little bit of insomnia, so I know I'm not alone in this. And so I think it's really important to step away from the screens about an hour or two before bed and let yourself get into that relaxed phase. I like to think of that, and I tell my patients that should be the time that's a gift to yourself, because you've been giving yourself to the world the rest of the day, and that's your time for you.
I love that. I'm struggling so hard with that myself sometimes, of like, oh, I'm in the middle of this project, I need to just get it done. And then I'm like, oh God, I'm out of time to sleep. So that thinking about it as a gift to yourself because you've been giving all day, I think is awesome. How much sleep are we actually talking about that we need?
Ideally, for most adults, it's somewhere between the 7 to 9 hour range. It's different for everybody. Some people function really well on that 7 hours, and some people, I'm sure listening to this, will say, well, I function great on 5. And it's more, you think you function great because your stress hormones are elevated and make you feel awake during the day, but eventually that will take its toll. So most people feel good on 7 to 9. I'm closer to that 9 hour range, and I think that's just recovering from medical school still 5 years later.
I hear you 100% on that.
Yeah, that's a good place for me. So sleep is really important, and I think that is your partner has to be on board with that. If you have a partner at home, I'm sure you talk about this all the time, but partners can sabotage us really easily. And so this is where having a conversation and opening communication to actually talk about the ways in which we need support from our partners, saying, I need to go to bed a little bit earlier. Can we maybe, like, instead of sitting in front of Netflix all night, can we get in bed and just talk and just communicate? Because that's going to strengthen the bonds of the relationship anyway.
Yeah, no, that makes a lot of sense. Are there other things besides sleep?
Absolutely. So diet plays a big role. And this is a huge thing I talk to most of my patients about. And I want to say it more in terms of nutrition. I don't like the word diet. People put a weird connotation on that, but it's just all about what you're eating. So getting an adequate amount of fat and protein in the diet is really important. Okay. Thankfully, people are starting to appreciate fat more now in their diet than they used to. But when it was really popular to be on fat restricted diets, it was not uncommon to see women and men come into the clinic and their sex hormones would just be tanked, because cholesterol is the backbone of estrogen and testosterone. You have to have it to support your sex hormones. And so making sure you're having healthy amounts of fat in the diet to actually upregulate your testosterone and your estrogen, and having enough protein to do the tissue repair. I think everybody thinks of protein in terms of muscle, but proteins are really the backbone of every enzyme in your body. They're really every cellular signaling pathway is built on protein. So making sure you have enough of that to also keep your cells functioning and turning over well is really important. Making sure that if you have things that don't make you feel good, I realize people may not be spending money on food sensitivity tests right now, but if you don't feel good after you eat dairy, maybe don't eat a pint of ice cream. That's going to make you feel really heavy and inflamed and phlegmy, and that's not sexy, So like avoiding the things that are causing digestive upset or bloating or brain fatigue, because that's going to put you out of the mood if you're not feeling good. You're not going to feel sexy, and that's going to turn down your libido pretty well. And then the other thing that just seems really basic, but is making sure you're drinking clean water. There's so many people in the population right now that are taking some kind of exogenous hormone, whether it's through hormonal birth control pills or hormone replacement therapy. And a ton of the livestock that goes into our food production are being given hormones as well. And ultimately, at some point along the process, those hormones are broken down in the body and pass out of the body in our urine. And that ends up in the groundwater. And so a lot of people think about water filtration for things like chlorine or heavy metals, but you really need to make sure that you have a filter that's actually filtering out hormones, which are much, much smaller molecules, because those can get in your body and that can disrupt your own hormone pathways as well.
Oh, that's really interesting. I personally had never thought about that. Do you have a filter that you like?
There's a couple different ones that I've been looking at. It's, it's interesting because there's a lot of water filtration companies, but not many of them are looking at this at all. Some of the ones that I've been looking at and trying to compare and see what they're doing, there's one by a company called Aquasana that I actually really like their shower filtration and home filtration systems. There's one that I'm looking at right now called Clearly Filtered. And I actually think that, is it the one that you can just buy on the market? Is it like Pure that hooks onto your tap?
Yeah, I don't know what the brand name is, but I know what you're talking about.
Yeah, there's a couple, and some of them actually will say that they do have a fine enough filtration to filter out the hormones, but I would definitely look for that if you're having concerns about that.
Okay, great.
Yeah.
Are there any things that I would look for in my own body, maybe besides libido, that would say like, oh, maybe I need to really pay attention to the water issue?
Yeah, so endocrine disruptors or hormone system disruptors come from many things. So it's not just your water; it can be from plastic or from metal or from any of the styrofoam, any of the containers in our world. And a lot of times endocrine disruptors can cause things like night sweats. They can cause mood changes. I started buying this shampoo and conditioner that I wanted to try, and they sent it to me with this synthetic perfume in it, which we don't use anything like that in our house. And I decided to just try it for a few days, and for like the probably 4 or 5 times I used it, every night I was waking up in just drenched in sweat because synthetic fragrances are hormone disruptors. As soon as I stopped using it, it went away. So it may not be your libido as much as you might find that your body temperature changes, you're having night sweats, maybe you're getting more irritable, maybe you're more fatigued, moods can fluctuate. It can certainly, if you're a menstruating female, it can certainly change your menstrual regularity and the way that you bleed. So there's a lot of little things, and a lot of times people will just say, I just feel off. Something just feels off, because we usually know how we feel, right? You're like, I'm sad and I don't know why, or I'm angry and I don't know why. Those are kind of indications that there may be something going on.
That's really interesting. Yeah. That's really great. Is there anything, so what are things that people come into your office with in terms of concerns regarding libido?
Most people who are coming in, I'll tell you, so every patient, no matter what they come in for, oftentimes they come in for something that's not really what you need to treat. I'm sure you've seen that as well. But every single patient that comes in, I ask them that question. How is your libido? How's your sex life? Any problems there? What's going on? Any trouble getting or maintaining an erection? How's things going with your partner? Because these are such important questions that can be a cornerstone to people's health, right?
I love that you ask about it.
Oh my God, it's so important. And I would say, unfortunately, the majority of the patients I ask that question to are struggling in some way. One partner or both partners will always say, well, like maybe we have sex, but I'm sure he or she would like it more, or I would like it more, but my partner is not as engaged, or, and then when I ask the further questions, like, well, do you talk about it? Oftentimes that there's a barrier there to being able to talk about it, because either it's awkward or they're afraid to talk about it, or if they do, the other one might get upset. And so there's a huge communication issue there. And so it's almost like people know there's a problem, but they don't understand exactly what it is, because we're not taught to communicate about sex or see sex in a healthy way in our country.
100%. 150%.
Yeah.
A lot of my day is spent talking with people about, okay, what do you think perfect sex looks like for you and for everybody? Like what narrative are you bringing into this conversation and this experience that you might not even realize is impacting the way that you feel about these things?
Yeah.
And I personally see a lot of people who are having pelvic pain who don't even realize they're having pelvic pain or don't realize that it's not normal. They're like, well, sex just hurts sometimes.
Oh yeah. Yeah. I mean, I've seen a lot of women, especially in my practice. I think the pelvic region is really where the seat of like power and intuition is for women. And it's happened so many times that I'll have women come in with something that, they would not categorize as like libido or sexual related, where maybe it's fibroids or recurrent chronic UTIs or, something that's affecting the genitourinary system.
Mm-hmm.
And they don't have an explanation for it. And you start going back into the history and you say, well, when did this start? And they're like, oh, it started years ago. And it's like, okay, well, what happened at that point in time? And almost 100% of the time, something happened in the relationship, right? They're either not safe in the relationship, something happened to, upset their needs in the relationship, somebody cheated on them, they cheated on somebody. There's something going on that for women especially, it seems that their emotional selves can manifest in very physical ways in the genitourinary system. And obviously that's true of men as well. We just don't talk about it as much or see it as much, which is also part of the reason I want to work with men, so we can highlight the emotional issues surrounding men's lives. So yeah, I mean, people will come in not even realizing it's a sexual conversation, and then find out that, wow, it really is. And if they can start to make adjustments in that relationship or leave an unhealthy relationship or communicate in that relationship, that those ailments will start to go away.
Yeah, totally. It makes a huge difference. And I have as part of an explanation to that, that I will often tell people, which is when you are stressed or afraid, especially if that stress or fear has a sexual undertone, your pelvic floor is the first group of muscles that activates. And it activates very strongly because your pelvic floor muscles run around orifices into the center of your body, which is a very sensitive area. So if you're talking about, if that's a dinosaur for you, your body's trying to protect you, right? And so the muscles turn on, your holes get smaller. It can make it hard to pee. It can look like urinary hesitancy. It can make it really uncomfortable to have intercourse. It can feel like there just isn't enough space, like your vagina is too tight. So noticing that in ourselves and noticing when those muscles are turning on or not turning on, relaxing or contracting, and noticing if that's happening in the bedroom, if that's happening when you're yelling at your kids, if that's happening when you're about to get in a car accident, if that's, when that's happening, are you someone who's typically gripping those muscles, and how is that impacting the blood flow to those muscles? And then of course, like your physiological arousal. So if you don't get blood flow down there, you're not going to feel very sexy.
Yeah, it's so interesting you bring that up. So there's actually been research looking at animals in the wild, that mammals who start giving birth, if they, let's say baby's like halfway out, if something comes into that clearing and startles them, their body will actually reflex and pull the baby back in so that they can get up and run away. Survival instinct. And we see this happening in humans too. If you think about the traditional like hospital birth setting, sometimes it can be very stressful, right? And people are wanting your cervix to dilate at a certain rate, and they're wanting your contractions to come at a certain rate. And it's very, very, very clinical. And when people get stressed out, the cervix clamps down, the pelvic floor clamps down, and it's not going to dilate, and it's not going to want to bring a baby into a world that's very stressful. And so we see that in a lot of different places. So it's very cool that you brought that up.
Yeah, that's really interesting. I actually do kind of like labor and delivery prep appointments. And sometimes that's like perineal massage and what can you do at home and what does breathing look like. But we actually I do not usually on the first visit, but normally the second one, because it can be kind of uncomfortable, as I will prepare people so they can decide if they want to do this or not, is I'll provide like some pretty significant pulling on their pelvic floor muscles as they're getting pretty close to pushing a baby out, because what I am doing in the office is only going to be a fraction of what you're going to experience like out in the world. But if you can overcome that feeling of like, oh, this is uncomfortable and I want to clench when I actually need to expand, people do really well with it. So yeah, that's really interesting.
That's beautiful. That's a really cool technique that you do that for women. I like that a lot.
Yeah. Yeah, it's great. People are normally, anything we can do to increase people's confidence going into birth and delivery right now, I think, especially right now, is great.
Yeah. Yeah.
I'm trying to think, is there anything else that we haven't already covered that you wanted to make sure that we talked about?
I think I could talk a little bit of just about, everybody's concerned right now about immunity and your hormones can play a role in that. So I'd be happy to talk a little bit about that just very briefly.
Yeah, awesome. No, that's great. Go ahead.
Okay. So, if we actually look at some of the research about this, it's been found pretty predominantly that estrogen upregulates your immune system. It acts as an immune system booster. And so it can increase all of the different white blood cell, little soldier activity that's going on in your body and prepare you better for a fight should you come in contact with a virus or bacteria. And this has actually been seen in different cultures around the world, even in hunter-gatherer populations, that when a virus comes through a community, the women seem to withstand it a little bit better and the men seem to struggle more. And so I think we can translate this even into, our community now, is that the people with higher estrogen, whether they're an estrogen producer or they're taking endogenous estrogens, may activate their immune response a little bit better. Whereas the more predominantly testosterone individuals might struggle more. What is interesting about that actually, though, is that there's a thought that because estrogen basically makes an overzealous immune response, that may be partially relatable to why more women suffer from autoimmune conditions, because it throws the immune system into overdrive. And so if we put that into perspective with what's happening right now, nobody's really talking about this or exploring this, but I think it's relevant, because if our estrogen can protect us slightly, it may also throw us into the cytokine storm that everybody's talking about that's causing the real damage. Whereas testosterone may shut down your initial immune response somewhat, and men may suffer more, which is what we're actually seeing statistically, but it may help prevent them from going into the severe cytokine storm reaction that we're all talking about. So it's really interesting to see how testosterone and estrogen can play a role in immune function.
Yeah, that's super interesting. So then what are your recommendations in terms of how do we support our hormonal systems and estrogen production without, I don't know, over creating estrogen that could possibly make us more susceptible to something like a cytokine storm?
Yeah, so I think, again, that comes back to your foundational pieces, right? Reducing stress as much as possible, but also some of the things that people are doing just on the daily without thinking about it, like taking your ibuprofen every day because it's just part of your regimen, that may be getting in the way of you doing things. There's some research studies out there that actually show that taking NSAIDs, taking ibuprofen, can reduce your hormonal response. So it can basically reduce your testosterone, your fertility, it can reduce your estrogen. And we know that testosterone is the backbone of libido, right? And so if we have this inflammation piece going on, I would be thinking, okay, what are better ways to deal with inflammation? Like exercise, getting enough sleep, drinking enough water, eating good anti-inflammatory foods, and not binging on ice cream and chocolate and pizza and all the things that it's easy to crave right now. And then, if you are somebody who has a higher inflammatory level in the body, mitigating that with things that aren't going to affect your sex hormones. So, in my practice, obviously, we reach for a lot of anti-inflammatory herbs or CBD or things that we know can mitigate the inflammatory response without shutting down your other hormone pathways or shutting down your gastrointestinal system or things like that.
I hope this doesn't put you on the spot a little bit, but this is something I've been thinking about, which is a lot of people are very nervous about gaining weight during this period of time. And so what I've seen is that there is a lot of exercising potentially, and then also a lot of calorie restriction and also stress around both of those things.
Yeah.
I would love for you if you could just speak a little bit to kind of what the positive and negative impacts exercise, calorie restriction, stress about either of those things, kind of how that could fit in.
Yeah. So I'll talk about exercise first. So exercise, I like to think about it just in terms of movement, because everybody thinks exercise means getting on a treadmill or going for a 5-mile run, and that does not appeal to most people.
Or doing 100 push-up challenges on Instagram.
Forget all that. Like any kind of movement, playing with your kids, being in your garden, that all counts. And so, primarily my favorite kind of movement that I am trying to get more and more people to do is strength training, just because the research that's coming out about it is so impressive that your muscles are more than just physique. Your muscles are really a built-in life insurance policy. And so if you are doing, and everybody can do it, your kids can do it, you can do it, grandparents can do it, because you can use your own body weight and you can scale appropriately.
And especially important for women, for people who often will end up being osteoporotic and have poor bone density.
Oh, yeah. And strength training is also great for stress relief, right? So I'm a big fan of strength training because you can do it without any equipment at home, and you can always level up. But too much exercise exercise is a stress producer, right? It creates a little bit of cortisol, and a little bit of stress is good. But if you have too much, if you're cranking it too high, then your body's like everything, like your mental function, your immune function, your libido will actually start to drop below baseline. And so there is a sweet spot of keeping your body moving. We know that staying too still, sedentary, can actually be more harmful and inflammation causing in the body. So just staying moving is good, but also you shouldn't be ending up in a pool of your own sweat every time you work out, every day. You shouldn't be doing that. I try to think about libido and sex and just overall feeling good as the goal is to nourish the body, right? You don't want to be depleting the body. And so if you're depleting it by over exercising or by calorie restricting to a point that you're starving yourself, both of those are going to increase stress, which increases cortisol, which decreases our libido and our sex hormones. But it also is just, it's pulling away all the nutrients that your body essentially needs to want to have sex. I mean, if we know that is a basic survival instinct, is to reproduce, like, you need to have nourishment for your body to be able to create offspring, right?
Yeah.
So I think there's certainly some research to support the idea of intermittent fasting, or occasionally fasting for like a 24-hour period or a 36-hour period, and that increases your white blood cells eating up viruses. But you don't want to do that for an extended period of time, because your cells still need nourishment and nutrients to do their day-to-day jobs.
And if you're peaking, right, and doing really, really heavy duty exercise and setting personal records and all of those sorts of things, that's also probably not the time that you want to be depleting your body of all of the nutrients it needs to be able to run those systems.
Way more. Those things go together. If you're going to be working out or strength training or moving your body more, you need more calories to support that. And that is what makes people feel like they have a libido and they're more excited, and because they're nourishing their bodies appropriately.
Yeah, thanks for talking about that. I've been thinking about it a lot, because I think right now in this time where we feel like we can't control anything, a lot of us are turning to food and exercise as something we can control, particularly, right, because our culture is very fat phobic. And the idea that like we could leave this situation and be heavier than we are right now is very distasteful and like feels very shamey for a lot of people.
Yeah.
And I had this realization myself, because I was kind of thinking the same thing. I'm like, my pants are not going to fit the same way in a couple of weeks. They don't really fit the same way now. Yeah. And then I was thinking to myself, okay, here are my options. One, let's consider the fact that I am in this time where I have very little control over my life, or feels like I have very little relative control over my life. And I can spend that time being worried, and I'm a healthcare provider and I'm working with people and I'm working in the hospital. And so I can spend that time worrying about that, or I can spend the time worrying about my pants not fitting.
Right.
And like, just that idea that like, it doesn't make the feeling of being uncomfortable go away, but it's like, okay, I'm going to save that particular discomfort for a later time when I have more time to deal with it.
Yeah.
Because what I worry about in myself and in others is that I see the stress about that thing. So the stress about the gaining weight, the stress about the calorie restriction, the stress about the exercise as being another dinosaur that you can't get rid of. Right. So now this is a pervasive, if everything that you do during your day is so that you don't gain weight at the end of this period, like that's a big fucking dinosaur.
Yeah, it is. And, I think trying to flip the script on it a little bit, or change the perspective and realize that your body, like your cravings for carbohydrates are driven by the fact that your body thinks you're running from a dinosaur. And so you need quick, easy energy for your muscles to run away, right? So our cravings are not any fault of our own. They're a built-in mechanism. And so everything our bodies are doing right now to deal with the stress of this, to deal with, being at home, is really like by design. And so I think if we can flip the script and just look at it through that lens and be like, wow, my body is actually doing what it's programmed to do and do the best it can to survive this situation, and look at that more from a lens of appreciation and fascination, and know that like everything is ever changing in life. As soon as this ends and we're able to go outside, like things are going to change, right? You're going to be able to move around more. And maybe now should be more about like understanding that our bodies are shifting to help us survive this. But in tandem with that, maybe we can use this time to think about habits that once this is over, we can carry forth, like working time into your day to go on a walk, spending time of your day actually focusing on mindfulness. And those are the types of things that are going to allow your body to get through this with less damage or baggage at the end of it.
Yeah, I love that. It's a both and situation. It's okay. It's realizing why you're having the cravings that you're having, why you're having the emotional responses you're having, why you're having the physical responses that you're having, and then doing the things that you can do to support yourself in this time in a way that feels good and to the word you used earlier, nourishing to yourself, like your whole self. And then if it's nourishing during this really terrible time, it will very likely also be very nourishing to you when this terrible time is over and make some of the other things that were already happening in your life a little bit better. Absolutely. So I think that's awesome. Thank you so, so much for coming on and chatting with me today. I think this was super.
Yeah, thank you so much for having me. It's great getting to talk to your audience as well.
Where can people find you?
Yeah, so they can absolutely find me online. So I'm on Facebook and Instagram, just at Dr. Kelsey Asplin. And then my clinic is Denver Naturopathic Clinic. So they can follow me on Instagram. I'm posting on there very frequently, but they can also head over to our website and they can get on our list so that they'll not miss anything that we're sending out there as well.
Okay, awesome. Thank you so much, Kelsey.
Yeah, thank you.